everyone, introducing my name is Elsa Rahma DINI, NIM P174102430076. Here I will deliver material taken from TED with the title Why Medicine Often Has Dangerous Side Effects for Women. Hello everyone, we all go to the doctor and we do some white trust and verify that the tests they are ordering and the medication they're prescribing are based upon evidence that's designed to help us. Where any difference between men and women, a recent government accountability study revealed that 80% of the drugs withdrawn from the market are due to side effects on women. So let's think about that for a minute. Do you know that it takes years for a drug to go from an idea to being tested on cells in a laboratory to animal studies to the clinical trials on humans, and finally to go through a regulatory approval process to be available for your doctor to prescribe to you. So why are we discovering unstable side effects on half the population after that has gone through? What's happening? Well, it's turned out that those cells used in that laboratory, they are male cells, and the animals used in the animal studies were male animals, and the clinical trials have been performed almost exclusively on men. How can the male model be our framework for medical research? Because women metabolize drugs at a slower rate than men. So it was decided that medical research was performed on men and the results were later applied to women. What did this do to the notion of women's health? Women's health becomes synonymous with reproduction. Bleeds, ovaries, uterus, pregnancy. It's this term we now refer to as bikini medicine. An overwhelming amount of evidence has come to light that shows us just how different men and women are in every way. Women have their own anatomy and physiology which deserve to be studied with the same intensity. Let's take the cardiovascular system for example. Why it seems men and women have completely different health attacks. Heart disease is the number one killer for both men and women, but more women die within the first year of having a heart attack than men. And so what is some of the evidence to help explain some of this difference? If we look at the anatomy, the blood vessels that surrounds the heart are similar in women compared to men, and the why that those blood vessels develop disease is different in women compared to men. The Institute of Medicine has said every cell has a sex. What does this mean? Sex is DNA. Gender is how someone presents themselves in society. And these two may not always match up, as we can see with our transgender population. Every cell in our bodies contains our own unique DNA, and then DNA contains the chromosomes that determine whether we become male or female, continue to remain active for our entire lives, and could be what's responsible for the difference we see in the dashing of dogs, or why there are differences between men and women in the susceptibility and suffering of disease. It's essentially changing the way we think about medicine and health and research. Martin Luther King Jr. has said, change does not roll in on the wheels of inevitability but comes through continuous struggle. And the first step towards change is awareness. This is not just about improving medical care for women. This is about personalized, individualized health care for everyone. This awareness has the power to transform medical care for men and women. And from now on, I want you to ask your doctor whether the treatment you are receiving are specific to your sex and gender. They might not know the answer. Remember, your sex and gender matter. Thank you.